Today we'll be presenting Michel's theory of uncertainty, brought to you by Lisa Nunez, Jacqueline Hernandez, Angela Araiza, and Sandra Miranda.
Here is an outline of the objectives of this presentation. We'll dive further into the theory of uncertainty in illness, the theoretical framework, how it derived, the history behind it, the application to nursing practice, and if this theory is defendable. Overall, the goal of this presentation is to examine how sick people might handle ambiguity in their illness or disease process. The recurring theme is patients' psychological needs must be met to accommodate their holistic health. Uncertainty can create tension or decrease quality of life for patients during their whole disease process, from acute conditions all the way to chronic or terminal diseases. Please follow along as we further elaborate on the theory of uncertainty in illness.
Michel's theory of uncertainty in illness was developed by Merrill H. Michel, a nurse theorist. The theory was first introduced in 1981 and was researched by Michel well into the early 1990s. Michel's early work was influenced by her background in nursing and psychology. In 1988, the theory of uncertainty in illness was published, and it identified the essential components of uncertainty and how it can significantly impact patient outcomes. Over the years, Michel continued to study and redefine her own theory. Based on her further research throughout the years, the theory was later expanded in 1990 when Michel discovered that the relationship between one's social support as well as the effective communication from healthcare providers can significantly alleviate one's feelings of uncertainty. At this time, she highlighted the importance of how a supportive healthcare provider and healthcare environment can contribute to how a patient navigates their uncertainties. The theory continues to be researched and expanded even after Michel's passing. Studies continue to validate her findings on this crucial theoretical nursing frame. Michel's theory first explored how uncertainty impacts patients and their families during chronic illness. She defined uncertainty in illness as a patient's cognitive state that results from insufficient cues or information that leads to the inability for a patient to develop a cognitive scheme or meaning to a situation. The initial research suggested that when a patient is faced with uncertainty, it can often lead to anxiety and difficulty in coping with their diagnosis. This in turn can lead to unfavorable health outcomes. Following her research in chronic illness, she later applied this study to cancer patients and oncology nursing. Based on the findings of both these studies, it became known to Michel that there was a need for a theoretical framework to better understand these experiences patients were having and how uncertainty was truly impacting the patient outcomes. Michel proposed that uncertainty impacts a patient's emotional well-being and coping mechanism. Therefore, managing uncertainty is critical to adapting during illness. This theory focuses on patients' perspective with emphasis on their subjective experiences and meaning. It explores how people cognitively process illness-associated events, develop meaning from them, and how the manner in which they cope can really impact their health. Feeling uncertain about any part of their health process can lead to increased anxiety, stress, and that can in turn lead to negative patient outcomes. Over the years, Michel continued to redefine and expand her theory. It has since evolved to include concepts from psychology, health communication, and focuses on the role that family members and healthcare providers play in managing a patient's uncertainty. This theory has since led to further research and has now greatly influenced a foundational component in nursing education and curriculum, as well as overall nursing practice. As healthcare professionals, we are taught to implement high quality, patient centered care that includes culturally sensitive nursing care through effective communication and collaborating with an interdisciplinary approach to support every patient need. Nursing greatly influences how a patient manages their uncertainty when making medical decisions, their emotional well being, overall patient satisfaction, coping skills, and health outcomes.
This portion of the PowerPoint ties in the concepts of uncertainty, which consists of three antecedents. The first antecedent is stimuli frame, and it is the foundation of the stimulus. It is made up of what the person perceives and their ability to form a cognitive schema. A cognitive schema is based on the individual's interpretation It is subjective to one's own experience. Formulating a cognitive schema then generates the second antecedent, which is cognitive capacity, which is dependent on the individual's psychosocial ability and their abilities to process information or their inabilities to do so. Having cognitive capacity allows the individual to process information intellectually and in a positive manner. An individual with cognitive disability will not be able to generate and process the information well. They would need assistance, or maybe they just won't understand. That would tie into the third stimulus, which is structure providers. The third antecedent. Structure providers are made up of social supports. It can consist of education, teachers, journals. It can consist of your family and your friends, whoever is in your social circle. Healthcare providers are also part of this. Any kind of IDT team. Religion is also part of the social support system to help an individual interpret their situation. Social supports play a role in how an individual will interpret and process the information or their situation in front of them. Once they process it, they then appraise it. They can appraise it as a positive or a negative event in their life. Appraising can then is generated based on inferences, which are based on the individual's experiences, or illusions, which are false beliefs, and it can create a danger or a missed opportunity. Having inferences that are positive based experiences can then generate opportunity for the individual to grow. Whichever route the individual decides, they will adapt to their situation. Adaptation is based on a biopsychosocial characteristic. It is unique to the individual. And there is a diagram here that will help you visualize the antecedents and the interrelationships. The concept was reconceptualized in 1990 to include self-organization. This is a subconcept. It stems from acceptance of one's situation, and it reorganizes the individual to generate new goals and new priorities. It's like an individualized care plan for the individual. The ability to organize new thinking is probabilistic thinking, and it refers to a belief in a conditional world in which the expectation of continual certainty and predictability is abandoned. With supportive structure providers, one is able to formulate a new life perspective, and this is when they adapt a new normal. The uncertainty is accepted, whether it is positive or negative.
Today I'll be discussing Michel's theory of uncertainty and how it was derived from nursing science and nursing knowledge. This theory was initiated by unexplained symptoms changes amongst several different cancer patients. These patients helped ignite the hypothesis for this theory. Michel used Lazarus and Folkman's stress appraisal coping framework, which describes how individuals evaluate and respond to stress, how they cope, and determine whether it was successful or not. So, using this framework, she created 4 major components to her theory. The first is antecedents generating uncertainty. This is what influences uncertainty. So, is it social support, education, healthcare professionals? This also influences the expectation of prognosis or interpretation of illness with patients. Second is appraisal of uncertainty. This is the assessment of a stressor and a coping resource. So, during this time, patients may adopt new coping mechanisms or experience confusion. And some patients prefer to remain confused regarding their prognosis. Third is coping with uncertainty. This includes mental and physical stress management associated to uncertainty. So patients may employ 3 different strategies. The first is mobilizing strategies, which is your actively involved patient. Second is affect control strategies, which emotional distress reduction by faith or emotional support. The third is buffering tactics. So these are your patients who choose ambiguity as an opportunity to decrease stress. Lastly is the adaptation to illness. So this is when patients find balance and adjust to the new illness related uncertainties well. Moving on, we're going to be discussing the 4 different types of nursing knowledge utilized for this theory. Empirical, which provides scientific basis. I believe Michelle employed this by identifying uncertainty in patients and practice. She applied research and framework to improve patient care for oncology patients. Second is aesthetic, which we know includes sensitivity and creativity. Michelle recognized nonverbal cues of distress in patients as well as inconsistencies in outcomes and actively searched for similarities and incorporated patients' psychosocial history to utilize a framework, right, and create a theory to improve patient outcomes, which change the way we provide care. Third is personal, which fosters authentic nurse patient relationships. This theory identifies a patient's support system and acknowledges their feelings towards their healthcare team, which in end builds rapport and fosters that authentic nurse patient relationship, which I believe Michelle accomplished. Lastly is ethical, which ensures care is morally grounded. Michelle advocated for patients everywhere by finding a link between these unexplained symptoms and changes and created a standard of care to improve patient outcome for oncology patients everywhere.
This slide focuses on how the theory can be applied to nursing practice. The theory of uncertainty in illness highlights how a patient's physiological state can influence their psychological state. Upon further research, peer-reviewed research article, Michel's Uncertainty in Illness Theory Informing Nursing Diagnosis and Care Planning highlights a need for nurses to address patients with uncertainty with glioblastoma multiforme. GBM patients are at a high risk of uncertainty for their terminal illness. Nurses utilize nursing diagnosis to form care plans with specific interventions to address patient needs. As GBM patients experience uncertainty, their quality of life goes down. The higher the uncertainty, the potential for the lower quality of life. The application to practice will be further broken down based on findings and examples based on evidence-based practice oncology nurses can utilize in their everyday practice in managing uncertainty in glioblastoma multiforme patients. This slide focuses on how the theory can be applied to nursing. GBM patients might experience higher rates of uncertainty due to cognitive changes or rapid memory loss from their brain tumor. An increase in uncertainty can inhibit patient coping, and also uncertainty can be due to the patients having a warped sense of reality. On the right side of the screen, you'll see examples of nursing diagnosis that can be applied to GBM patients. Rankin and Reed's research article highly focused on having interventions to address patients having a lack of understanding or uncertainty that could potentially decrease their ability to cope or adapt to their chronic and terminal diagnosis. Care plans can be generated to help with interventions for these diagnoses to help decrease patients' isolated behaviors due to an increase in knowing. The more knowledge a patient has, the more empowered they can be. Uncertainty can occur with any illness, but especially with patients with terminal illnesses as aggressive as GBM. Nursing diagnoses can directly influence a nurse's practice and how they address uncertainty with their patients. This theory is defendable in evidence-based practice based on the information from the previous research article in the last slide, and also the research article Illness Uncertainty and Its Antecedents for Patients with Prostate Cancers and Their Partners by Guan et al. This article focused on how symptoms are stimuli that can increase uncertainty in patients. The study also focused on newly diagnosed patients and their partners of prostate cancer and recurrent diagnosed patients and partners. The study had a 12-month-long period of collecting data using variables to score the patients and their partners' uncertainty and the effectiveness of psychoeducation addressing that uncertainty. Results showed partners experienced more uncertainty than patients, and uncertainty was linked between general symptoms, urinary symptoms, and sexual symptoms of prostate cancer. Research solidified oncology nurses need to include partners in holistic care and the symptom management education linked to the uncertainty. All of this information links back to the need for specific diagnoses by nurses in nursing diagnoses to help address care plans that can help address the uncertainty and illness needs of patients.